Good morning, everybody. My name's Samantha, and I'm the provider, one of the providers here at Mountain Ear Hearing. Today, we're going to talk about how other health conditions affect your hearing loss, okay? A lot of people have different health problems. Some of those are diabetes. These are health conditions that can affect your hearing loss. Diabetes can, high blood pressure, can contribute to hearing loss if left untreated, okay? Viruses, bacteria, including ear infections, can also lead to hearing loss. Heart conditions, strokes, brain injuries, or tumors. Sometimes the position of where a tumor is or the placement can lead to hearing loss. Certain medications are what we call ototoxic to our hearing, and the ototoxic medications can damage the inner ear and sometimes leave it permanently with a hearing loss. A few of those drugs include treatments for severe infections, cancer treatments, the chemotherapy drugs, they're very toxic. Also, heart disease. I'm not telling you to stop anything. You continue to take your medicine like your doctor says, please. But if you do suspect that you're having an issue, say something to your doctor, okay? Even an aspirin regimen. Some aspirins, the doses of it can be ototoxic. This could have led up to some hearing loss problems. But always check with your doctor. Let them know when you're having issues with this. One thing that can also cause hearing loss, is heredity. Sometimes it doesn't show up right at birth. It kind of gradually comes on. You may say, oh yeah, my grandpa, he wore a hearing aid, or my grandma did. But what's happening is, it's otosclerosis. There's little bones inside the ear which contribute to help us hearing. It's in the middle ear, and these sometimes with the otosclerosis will have an abnormal growth, or that can prevent the ear from functioning properly. So that's one of the things, and we hear about that in other areas of our body too. Another contributor may be rheumatoid arthritis. Again, you've got a type of autoimmune disease. Rheumatoid arthritis is a type of condition that causes our pain and inflammation in our joints. Well, those little bones in there, they have joints in them just like our other bones, but they're very tiny. But if you have rheumatoid arthritis, it could cause damage in those cartilages, the bones, and surrounding tissues. It's estimated that over about 75% of people with rheumatoid arthritis also develop a hearing loss. Another health condition could be influenza. And now we have COVID-19 with some of the similar symptoms of influenza. It could risk that also. So while these symptoms include fever, fatigue, achy muscles, it can also lead to both temporary and permanent hearing loss. You may feel like your ears are clogged, and this is caused by a buildup of fluid in the eustachian tubes and in the middle ear, which goes away once your body recovers from influenza or any type of high fever, achy bodies. But in some instances, the flu virus can affect the hearing organ in your ears directly. It's not treated, permanently hearing loss. Another cause that could happen is meningitis. Meningitis is a different form, comes in different forms. You got viral meningitis, bacterial meningitis, fungal, you have parasitic meningitis. Meningitis is typically an inflammation of the membrane surrounding the brain and the spinal cord. And its link to hearing loss is one main side effect is that meningitis, especially among young children, because of the inflammation, it can affect the nerves that run from the ears out to your brain, that meningitis, because that's what it controls, the brain and the nerves and everything. The hearing loss with meningitis can be reversed if in some instances, but about 10% of children have permanent damage from meningitis. So if you're experiencing any changes in your hearing, always see your physician, and then they can refer you to us, or you can make a phone call, schedule an online appointment. We'll go over your hearing problem with you, kind of see which direction you need to go in, and help you out if all that we can. You can either register online for a free hearing evaluation, and you can also call the number that's linked to this video. Till next week, I hope you have a good week and stay safe out there.